question, please press 1, then 0. I would now like to turn the conference over to Supervisor Catherine Barger. Please go ahead.
Thank you. Good afternoon, and thank you for joining us for our daily briefing on Los Angeles County's response to the coronavirus. I'm Supervisor Catherine Barger, Chair of the Los Angeles County Board of Supervisors. With the current health orders in place, we have asked everyone to stay home unless they are working to provide essential service. As a result, we are seeing a rise in requests for assistance. So many people want to go to work, but understand that for the greater good, they must stay home. The state released data on Thursday showing a 370% increase in unemployment insurance claims processed from the week prior, jumping from 186,000 to 880,000. Meals provided to seniors has jumped 70% from February.
Welcome. Please enter your access code and press pound when finished.
The state's food assistance program has seen an increase of 38% in the last month, with nearly 70,000 applications in March. CalWorks, the state's jobs assistance program, has seen an increase of 32%.
That doesn't appear to be a valid access code. Please re-enter your...
Received a total of 1,300 inquiries from constituents related to COVID-19 in the past 2 weeks, and that number is sure to increase. These are staggering and unprecedented numbers. The county implemented an eviction moratorium to keep people in their homes because they are making a sacrifice for the good of our community. It provides a temporary halt on residential and commercial evictions for tenants who have been financially impacted by the COVID-19 and can't pay their rent as a result. The moratorium is retroactive to when we declared the local emergency on March 4th and goes through March 31st unless it is extended. Tenants will have 6 months to repay their rent, though we encourage tenants and landlords to work together to come up with a payment plan. The moratorium has some requirements for tenants, including notifying your landlord of your inability to pay and some documentation of impact so we can focus relief efforts on those truly in need, which our council is currently working to clarify. In addition, the county issued an executive order placing a temporary rent freeze on eligible residential properties in the unincorporated areas of Los Angeles County. This means that owners of multi-housing built before February of 1995 may not increase their rental costs for tenants until May 31st, unless that is also extended. Additionally, the county is extending deadlines for housing assistance recipients and applicants for eligibility and are working with the state to secure relief for foreclosures. We have created a new task force made up of staff from key county departments to provide targeted assistance for constituents and small businesses to access local, state, and federal resources available. Joe Nikita, our Director of the Department of Consumer and Business Affairs, is going to join us today to provide more information on these programs. I want to thank each person in our communities for everything you are doing to keep Los Angeles County safe and healthy. With that, I would like to invite Dr. Barbara Ferrer up to give her daily update. Thank you.
Good afternoon, everyone, and thank you so much, Supervisor Barger, for all your leadership across the county during these stressful and difficult times. I've appreciated being able to work for you and benefited from your wise counsel every day. But I also want to thank all of the other leaders across the county and across the state for all the support to make sure that we are able to, in fact, slow the spread of COVID-19. I'm sad to report an additional 25 deaths today, which brings the total number of deaths in LA County to 223 people who have passed away. And unfortunately, our mortality rate once again has risen slightly to 2.8%. Every day I report these numbers knowing that there are people who are grieving their loved ones who have passed away from COVID-19. And to all who are mourning, we're deeply sorry for your loss, and you remain in my thoughts and my prayers. Today, we're also reporting 425 new cases. This means that over the last 48 hours, there's been 1,045 new cases in LA County, and that there are 7,955 total cases in LA County. These cases include 287 people that were reported as positive for COVID-19 from our partners in the city of Long Beach, and 94 cases that were reported by the city of Pasadena. We're also confirming 20 cases among people experiencing homelessness in LA County. The vast majority of these cases are people who are unsheltered. We're investigating 4 people experiencing homelessness who resided in shelters, and there are ongoing investigations at those sites, and appropriate quarantine efforts and isolation efforts are practiced. I also am really sad to report that one of the staff members from one of the shelters has passed away, and I know you all join me in expressing our deep condolences and our gratitude to this person's family. We're so very sorry for your loss. 77% of all of our positive cases remain among people between the ages of 18 and 65. Because this number has remained consistent throughout since the very beginning of us being able to report on the number of cases, I urge everyone to remember how important it is to understand that we need universal precautions, because we're all able to get sick from this infection, and unfortunately, we're equally able to transmit this infection to others. I want to thank the Sheriff's Department and the Fire Department for sharing their data on their employees who are positive or have had to quarantine because of COVID-19. The LA County Sheriff Department is reporting 27 positive cases amongst their staff. They've had a total of 447 staff members who were quarantined, and 188 of those who were quarantined are back at work. The LA County Fire Department is reporting 14 positive cases among their staff. They have 26 people who are quarantined at home. 2 people who are at home are in isolation and are ill, and 12 who have already returned to work. I want to thank Sheriff Villanueva and Chief Osby for tracking and reporting this data. 1,894 people have at some point been hospitalized for COVID-19. This is 24% of all of our positive cases. Again, I want to note we've had a slight uptick all week in the percent of people who are positive who are requiring hospitalization. And somewhere between 20% and 35% of people who are requiring hospitalization are also requiring intubation. This requires the use of ventilators. So these are numbers that we're also tracking, and it also is a sharp reminder that many of the people who are in the hospitals are in fact very ill from COVID-19. So as we've noted before, COVID-19 does in fact cause serious illness, and folks are often treated in the ICU when they go to the hospital. You can see an updated report of our county cases on our Department of Public Health's website, publichealth.lacounty.gov. We're also currently investigating 155 institutional settings. This is 24 new institutional settings from yesterday, and these are institutions where we have at least one confirmed case of COVID-19. As a reminder, these investigations are happening in nursing homes, assisted living facilities, shelters, treatment centers, supportive living, and correctional facilities. The total number of confirmed cases in institutional settings has also risen to 716. 343 people who have COVID-19 at these settings are residents, and 373 are staff. I'm sad to report that 51 residents
Welcome. Please enter your access code and press pound when finished.
23% of all of our deaths have occurred among people who are staying in institutional settings, and of course, most of these are among elderly people staying in nursing homes and assisted living facilities. We're also confirming 47 cases.
That doesn't appear to be a valid access code. Please re-enter your access code and press pound when finished.
There are 11 cases in the state prisons in LA County, 8 inmates and 3 staff, and same number for cases in our juvenile facilities. These are 2 cases, and they're both among staff. As a reminder, we post a list.
That doesn't appear to be
with confirmed cases on our website once they've notified their staff, their residents, and the family members. And I want to note that as of today, you should be able to see an asterisk next to every facility that has 3 or more resident cases that are positive for COVID-19, or 1 positive resident case plus 2 highly suspect cases. This will be the way we'll try to continue reporting. That's our definition of an outbreak, 3 or more cases at a facility among the residents. And just as a reminder, a sad reminder, that the more cases we have of COVID-19 in our community, the more cases we will see and outbreaks we will see in our institutional settings. But I do note that the management and the staff at all of these settings are doing their very best to protect the health of the residents and the employees, and we're grateful for their support. When our staff go in from the Department of Public Health to conduct investigations, we have the utmost cooperation. There's not a single person working or managing these facilities that does not want to see us quickly be able to together work to make sure that we don't continue to see more cases, especially for those residents who are very vulnerable for serious illness. As of April 8th, over 38,300 people have been tested in LA County. Thank you, Dr. Kazan. Every day this week, pretty much, we've opened new testing facilities. 15% of people who have been tested to date were positive. And as I noted before, we're still waiting to get negative test results from a couple of the labs. I want to make sure that folks know that we are still recommending testing only for those people who are symptomatic. I particularly want to note that if you're under a quarantine order, you're a close contact, and you're asymptomatic, please don't think if you go and get tested and your test is negative that you can then leave your quarantine earlier than the 14 days. You have to stay for the full 14 days of the quarantine order. That's because it takes 14 days for this virus to incubate. So I ask for your cooperation on that. I also, we received a lot of questions over the last couple of days of people who have been tested and are confused about what they're supposed to do while they're waiting for their test results. So I want to address that today. So if you've been tested, and since the majority of people being tested are symptomatic, you've been tested, you're waiting for your results, you have symptoms, you need to stay home and self-isolate while you're waiting for your test results. Please, please don't wait for a confirmation that you're positive to begin your self-isolation. You actually need to self-isolate at the moment you started having symptoms. And this is particularly important because there's still a lag time from the time you're getting tested till the time you're getting your test results. You need to isolate. That means you need to stay away from everyone, even your other household members. You shouldn't be sharing anything. You should try not to share bathrooms. If you have to share a bathroom, you need to clean the bathroom after every use. You should be making sure that even in your house, you're using your face covering if you have any times where you need to interact or be in shared space with others. Once you get your test results, if you're positive, you need to complete your isolation period, which is for at least 7 days, with 3 days needing to be symptom-free and fever-free. Oftentimes, for people who have symptoms of COVID-19, we're talking about 2 weeks while they're experiencing their illness. So that entire time you need to self-isolate. You also need to notify all of your close contacts, and your close contacts include anybody that you were around 48 hours before you developed any symptoms. So anybody in your house is a close contact, any caregiver, if you're an essential worker, anybody you may have exposed at your workplace, and all of those folks need to quarantine for, again, the full 14-day period. That means they too need to stay home. This means no shopping. This means please don't go and join others for dinner. This means stay home, stay apart from others as much as possible. It may take as long as 14 days for you to develop any symptoms. And until you've completed that 14-day period, it is not clear that you are not going to become infectious yourself. I know this is a lot to ask for folks, but I want to clarify, while you're waiting for your test results, if you have symptoms, we need you to act as if you're positive. So please go ahead and take care of yourself and make sure that your close contacts are aware that they are needing to quarantine. I want to close by just noting that in these very difficult days that we're living through, one aspect of medical care, routine medical care, should not be forgotten, and that is care for children, well-being care for children. And I know that there are many preventive services for those of us who are adults that we will delay. But the one thing that should not be delayed during this time of staying home and being safer at home are making sure that newborn and well child care visits, especially those that require an immunization, are still happening. There should not be long delays in making sure that children are fully immunized. There's a lot of other diseases like whooping cough that are circulating and that can be prevented through immunization. So please check in with your child's provider if they're due for a routine check that involves an immunization, and make arrangements so that your child can stay fully immunized during these difficult days. And we know that there's challenges. Many sites may have closed. Many sites may have limited hours for being able to see children, particularly children for a well child visit. But we ask you to make sure you're staying in touch with your provider and not delaying life-saving immunizations for children. As I mentioned earlier this week, we're going to need to continue the measures we're all taking now so that we can continue to slow the spread. The data is encouraging. We've heard that from many different leaders at the federal level, the governor, and even here in our county. We know that all of the sacrifices, and they are huge sacrifices that everyone is making, is in fact slowing the spread. But slowing the spread is a consistent activity that we have to continue to do for many days to come. So I ask you to have some patience, continue to do everything you're doing to take care of yourselves and your loved ones. I know that this new reality that we're living in is not forever, and that we're going to come out at the other end in the matter of weeks. But we do need to stay the course for the next few weeks. So thank you for being so incredible during these really devastating times for so many of us. Thank you for holding on to hope. Thank you for caring for each other. And I know that together we get to the other side. And now I'm going to introduce Joe Nikita, who's the Director of Consumer and Business Affairs.
Thank you. Good afternoon, everyone. Again, my name is Joe Nikita, and I'm the county's Director of the Department of Consumer and Business Affairs. And like Dr. Ferrer, I want to begin by sharing my thanks and my admiration for so many of you who have heeded the call to stay safer at home. And I offer my thanks because by staying safer at home, we know you're prioritizing the health and welfare of our entire community. And I express my admiration because I know that for so many of you, staying safer at home comes at a cost. You may be keeping your business closed out of respect for a public health order, or perhaps you're a worker who's had a reduction in hours, or maybe you've lost a job. If that's you, then you know better than any of us that COVID-19 is at once a health crisis and an economic crisis. LA County is home to nearly 500,000 small businesses that employ about 1 million people, and it's government's obligation in times like this to step up in support of those who by their blood, sweat, and tears are the engine that drives our local economy. And I'm proud of our County Board of Supervisors and our elected federal, state, and local leaders for marshaling badly needed funding to support our entrepreneurs. The Board of Supervisors will be considering a motion next week to establish a county relief fund for small businesses. And like I said, it's so needed right now. But in addition to financial support at the county and at the Department of Consumer and Business Affairs, we know that timely, accurate information is critical. If you're a business without a pre-existing credit relationship with a bank, without a loan, or maybe you have no relationship at all because you're unbanked or you're underbanked, if you're in the gig economy, if you're outside the formal economy, if you don't speak English, folks like you are often the last to find out, the last to know, and the last in line. So my department's mission and my mission is to support you and the entrepreneurs like you. As Supervisor Barger alluded to in her remarks, on March 26th, with the support of the county's Board of Supervisors, the county launched the Business and Worker Disaster Help Center. This is a help center staffed with real people, live people from my department and from departments all over the county who have stepped up and volunteered their time to support our business community. We have workforce development professionals on the lines. We have converted business license inspectors, reference librarians, and park staff, and others. These folks are trained up and they're ready to take your questions as business owners and point you in the direction of available resources. And by the way, collectively they speak 9 languages, including Spanish, Mandarin, Armenian, Korean, and others, and we're expanding our language capacity daily. Help Center staff can counsel you on the Federal Paycheck Protection Program, fondly known as PPP. They can talk about the Federal Economic Injury Disaster Loan Program, as well as a multitude of local funds that have been created over the last several weeks, offered by the county, the city of LA, and philanthropic organizations in the region. And once you understand what your options are, we take the next step. Help Center staff can actually provide technical assistance to guide you through the decision-making process and the application process as well. This technical assistance extends to workers. So if you're one of those workers who is experiencing unemployment, underemployment, or loss of wages, our team can guide you through the process of filing for unemployment, disability, paid family leave, and can also connect you with new working opportunities and workforce training options. The Help Center staff, the Help Center is also the place to find out if you're an essential business under an applicable public health order, or if you're a non-essential and have to close. We know there have been lots and lots of questions that we fielded about whether a business falls within the parameters of a public health order. We can answer those questions. I will note that in the coming days, we will be expanding our Help Center to include information for landlords and tenants. Also, extraordinary amount of concern coming from our communities about the rules applicable to rental situations. Right now, my department provides that information directly through our website and our call center. We're available now to discuss any landlord-tenant concerns, but I think the last thing people need is another website, another phone number, so we'll be centralizing that through the Help Center in the coming days. As Supervisor Barger mentioned, the county has declared a temporary moratorium on evictions of both residential and commercial tenants. That's residential and commercial. A lot of people miss the second part. If you're a small business owner or a business owner generally, this moratorium applies to you in the unincorporated areas. The board has also issued an executive order placing a temporary rent freeze on eligible residential properties in the unincorporated parts of the county. The city of LA and other cities in the region have taken similar measures. These are necessary now to protect those who are suddenly and unexpectedly unable to make rent due to novel coronavirus, but it does make a difference if you live in the unincorporated county or the city of LA or the city of Glendale or Long Beach, etc. The rules are slightly different across jurisdictions. Whether you're a landlord or a tenant, regardless of where you live, my team can help you sort it out. We have all the information necessary to advise you of your obligations and your rights. So I'm going to give you a phone number and a website. The phone number is for our Help Center. It's 833-238-4450. You can call that line to get information if you're a business or a worker today, and in the coming days if you're a landlord or a tenant and you need information. The website you've heard before, it's covid19.lacounty.gov. All of the resources my department provides and all of the resources available through my colleagues in other departments are warehoused on that site. If you haven't been there already, I urge you to take a look at that website. There is so much information there that can help you through this time. And so that concludes my remarks, and I believe now we'll go to Ryan. I think we're ready for questions.
Okay, ladies and gentlemen, if you do wish to ask a question, please press 1, then 0. Our first question is going to come from the line of Kristen Devine. Please state your media.
Hi, Christine Devine, Fox 11. Can you hear me?
Hey, Christine. Yes.
Hi, so my question is for Supervisor Barger, and this is an issue we've worked on together. Would you be so kind as to address the issue of foster care? Where do things stand with the county when it comes to the need for foster homes? Are you still taking foster homes? What about adoption?
So, that's a very good question. And first of all, thank you for everything you do. Obviously, even pre-COVID-19, foster homes are always a challenge for us and always recruiting. It's different now, and the reality is that we are taking all precautions as it relates to recruitment. Even with our social workers going out, we're providing them with protective gear. So we are still in operation, but not as robust as prior to COVID-19. But we are always looking for foster families that are interested in either fostering and or adopting. And then the adoptions is it's all going pretty much the same. The only thing is the courts are a little different. As you know, they're doing it on a different calendar. So that's a challenge with the courts. And I don't know really how they're going about doing it in the dependency court.
Thank you.
Thank you. Next question.
That will come from the line of Claudia Prosciutta. Please state your media outlet.
Claudia with KNX News Radio. I have a few questions. Any outbreaks among the homeless population? Given the incomplete testing data, Barbara, I'm wondering how concerned you are about the rising mortality rate. Yesterday, you mentioned 2 deaths among healthcare workers. Is it still 2? I presume 1 was the jail nursing staff member reported yesterday by the LA Times. I'm wondering what the setting was that the other person worked in. And also, Barbara, you've called this stay-at-home week. Do you think next week will be another stay-at-home week? Thank you.
Thanks, Claudia. I appreciate the questions. So the stay-at-home week, well, it's for all of us, it's stay-at-home at this point. Safe at home is stay-at-home for everyone who can. I was particularly concerned this week because, of course, our numbers are going up, as are our deaths. And it's particularly important for people to avoid being out of their house unless it's absolutely necessary. So I was encouraging people to use this week as a week to really try to avoid doing as many things outside of the home as possible, with the exception of sort of going for a solitary walk. That's always a good idea, but really to avoid contact with other people is the idea. I will suggest that we remain really dedicated to being safe, and being safe means safe at home, for the next few weeks to come. So from my perspective, everything we can do to avoid having to be in contact with other people is a really good idea at this point. I think in terms of outbreaks at any of the shelters, our policy when we have a case at a shelter or at a nursing home or at an assisted living facility is to work with the management and identify close contacts and, in fact, make sure that with those close contacts, they're quarantined. We have a number of people at a couple of shelter sites where we're doing investigations that have, in fact, been quarantined, and a number of people who are undergoing testing, but we don't have, as you noted, the conditions that really call it an outbreak, 3 or more cases at any of the shelters at this point in time. But again, I would imagine that as we continue in the days ahead, we will have outbreak situations in almost all of our institutional settings. These are places where people often are sick, and they're also places where people are often close with each other. A concern about the rising mortality rate, you're absolutely correct. I'm concerned. I look across the country and I note that in many other places, mortality rates are in fact rising slightly. I do want to note that the mortality rate is a reflection of the number of positive cases, and if we're not yet able to test as many people as we'd like. That mortality rate is likely to drop once we've increased the number of people that are tested and that we can determine are in fact positive. But a rising mortality rate is never something that we would say we shouldn't be paying attention to, or that everything's okay. We'll take the next question.
And that comes from the line of Alexandra Wigglesworth. Please state your media outlet.
Hi, it's Alex Wigglesworth from the LA Times. Just wondering, does the Department of Public Health keep track of how many people are tested post-mortem? And if so, how many there have been? And then also, are you working with the coroner's office to conduct swab testing of all bodies it handles, or are those all bodies of suspected coronavirus cases?
Yeah, those are good questions. I don't have the answer to the last question. I think that's a question for Dr. Lucas, and I'm sure he'd be happy to answer that if you call over to his office. We do work really closely. I mean, most importantly, what we're all trying to do is make sure that we catch, even if it's post-mortem, that we catch all of the positive cases. And his team works on a regular basis with all the members of our team to make sure that that work is happening and that cases are accurately reported. So I can give you assurances that even when there's testing that happens, unfortunately, after someone has passed away, those results are reported to us and they are included in our daily tabulations of the number of people who have died. Thank you. We'll take the next question.
And that comes from the line of Betty Halsell. Please state your media outlet.
Hi, this is Betty Halsell from LA Sentinel. First, I want to thank you guys for keeping the county informed. This is not the easiest news, so I can't imagine the weight that it carries when you're delivering tragic news. Speaking directly to Barbara Ferrer. However, I have to ask your opinions and thoughts on the impact that COVID-19 has had on our economic system and our finances as well. The homeless have always been exposed to a life or death situation, have always been exposed to elements. The losing of jobs, the unemployment rate has always been there. So I kind of want to know exactly how these solutions are coming forth when the problems have always been there. There's always been a call for the digital divide to be closed. Also, my last question is, do we have any update on the fatal cases of COVID-19 by ethnicity, specifically African American? Thank you.
Thank you. I really welcome your question about, what's the impact of a pandemic on, sort of everything in our society, especially sort of the economic impact, as well as, obviously the social impact, the personal impact, the emotional impact. I do want to say, I think a pandemic really surfaces many of the issues and the challenges that we've been facing for a long time as a society. It definitely exacerbates the disproportionality we see every day that we do our work here in the county, not just in times of incredible disruption. Those people who are most affected by this pandemic tend to, in fact, as a group, be those people who are disproportionately earning less money, disproportionately have on average many more underlying health conditions, disproportionately have in fact the kinds of jobs that may not afford them all the protections that they would wish they had, including being paid if they're needing to be furloughed. And for our homeless, it's certainly acutely recognized that having a large number of people, 45,000 people that are unsheltered, is a particular challenge for every single person that's unsheltered and for all of the wonderful people that are trying to support people who are unsheltered. So I don't think there's anything that I can add to the fact that the devastation that we see in our communities because of having to live through a pandemic now is in fact disproportionately felt by some of our most vulnerable residents. But I want to note that the silver lining is that you also see great acts of generosity from everyone during these times. And, that's our hope. People are coming together as a community. We're working both to address the underlying conditions that contribute to the disproportionality, but also take immediate action to try to acknowledge that this has a disproportionate impact on some folks and that we need to pay particular attention to doing everything we can to protect the health and well-being. And that's the physical health, the emotional health, the economic health of all members of our community, but particularly those most vulnerable at this time. I don't have an update at this moment on our being able to give more complete data around race and ethnicity of those who are both hospitalized and around those who are dying. But we are working on a report, and we'll be issuing a report every week over the next few weeks to really take a deeper dive into race and ethnicity data. So thanks for your questions. We'll take the next question.
That comes from the line of David Rosenfeld. Please state your media outlet.
Yeah, hi, I'm with the LA Daily News. I just wanted to thank you very much for answering our questions every day so thoroughly and patiently. We all really appreciate it. Changing gears a little bit, I was wondering if I can get a comment about the Mercy ship. Yesterday, late yesterday, it was reported that one of the crew members had the virus. I'm wondering if it's going to change its mission in any way. And secondly, I was wondering if you could comment just briefly on the difficulty or how you exactly confirm a death is related to coronavirus, or how we should be referring to this. There's some pushback on whether we can say the person died from COVID-19, or in every case, is it not in relation to, or so forth, or how should we be accurately explaining this? Please, thank you.
Yeah, hi, I'm Dr. Christina Galley from the Department of Health Services. I'll take the first question and then I'll turn it over to Dr. Ferrer for the second question. Regarding the Mercy ship, I'm not able to comment and don't have the information specifically on the first part of your question on the individual. I would encourage you to reach out directly to the federal government or to the Mercy ship. They have press personnel who are able to answer questions about situations on board the Mercy ship. With regard to what was part of your first question, there is a lot of discussion, as you can imagine, over time, just what's the best way to continue to track this virus over time, with attention paid to all of the different resources that are needed within the community to provide support. And so as this has evolved over time, there are certainly active discussions that are going on about what's the best use of the Mercy ship, and would that be still best in which type of environment, and what kinds of resources are needed, what kinds of patient populations would be best cared for on that ship. Would it be best to pivot the use of the ship to care for a slightly different population? So those conversations are ongoing. As of today, it's still the same plan and the same practices in place of having them care for COVID negative patients being transferred by interfacility transfers from existing hospitals over to the ship. But that remains fluid, and we'll continue to reevaluate in partnership with the federal government over time.
Thanks a lot for your question about how we're classifying deaths. So it really is deaths that are occurring to a person who has passed away, who has a diagnosis of a laboratory confirmed test that's positive for COVID-19. For many of these patients, in fact, when you look through their death records and their medical records, it'll be that they passed away from complications associated with COVID-19. But we will capture all of the deaths that are happening for a person that has a diagnosis of COVID-19, a positive case of COVID-19. So thanks for the question. And we'll take one more question.
Okay, that will come from the line of Steve Gregory. Please state your media outlet.
Good afternoon, Barbara. Steve Gregory, KFI News. Thank you for taking my call. Dr. Ferrer, I wanted to find out, and if I missed it yesterday, I apologize. You were talking about when you did give ethnicity information, you spoke about a little bit of a higher case number in the African American community. Is this going to lead you or your office, your team, to be more aggressive in getting testing into that community in respect with in kind of a testing center, mobile testing site? How is that going to shift your mission in terms of getting the testing out there? Also, a question for Mr. Nikita. If there is an effort underway to help those that were negatively impacted by AB5, I don't know if that's appropriate for you or maybe Madam Chair Barger, but we're getting a lot of feedback from people here that are negatively impacted by AB5 for some sort of relief in the form of unemployment insurance or something like that. They're having lots of problems and issues dealing with the state, and I don't know if you can address that. Thank you.
Sure, thanks a lot. And I'll start with the first question. I do want to also acknowledge and thank all of the media. You're doing a brilliant job covering this very complicated time for us and really presenting information extraordinarily that's extraordinarily difficult in a very accurate and easy to understand way. So we're in your debt for doing such a good job. Yeah, we're deeply disturbed, as I noted a couple of days ago, by the preliminary data, and it is preliminary data, and we need to get more complete data that indicates two things. One is that African Americans are dying at a higher rate than we would have anticipated based on their numbers in our population from COVID-19. And it's not just here. This is data now that's been confirmed from across the country. And it's similar data that we note for many other illnesses that we track, that African Americans have a disproportionately poor outcomes when compared to all others in our populations. I am also troubled by the data that we have that indicates that in our less affluent communities, there's also been less testing, which, for all practical purposes would translate as perhaps less access to testing. So the combination of having higher rates of mortality among African Americans and having less access to testing means we do have a lot of work to do, and we have to do it right now. And I'm really grateful both to all of the folks that are currently working in lower income communities with less resources to quickly ramp up testing. I want to note that there was testing this week at the MLK campus, and I want to thank Dr. Kazan and all of the partners that got that set up. But obviously, it does change what we need to do. We need to be very deliberate about making sure that we improve access to testing, and we need to also be very deliberate about making sure that everyone has access to the kind of information that helps them make good decisions during this difficult time. So we'll be doing both of those. We'll be out and about. It's not really physically out and about, but we'll be out and about virtually in our communities, making sure that people are getting the kind of information that they need, and that we're helping to support people who, again, may be struggling more than others during these times, because that's also going to be really important, along with access to testing. But thank you so much for your questions. And now,
one more, AB5.
Oh yeah, AB5. Sorry, Joe.
Good afternoon again, Joe Nikita with Consumer and Business Affairs. AB5 is the law that came into effect on January 1 that changed the way businesses classify whether somebody is an independent contractor or an employee, with a strong preference to classifying them as an employee. It has created confusion. We've heard it. There is confusion in a number of levels. One area of confusion might be if you're a business looking to access federal resources, in particular Paycheck Protection Program, how do you classify those employees who you may recently have converted from an independent contractor to an employee? If you became an employee and you lost your job, are you eligible for unemployment? If you were not quite through the conversion process, or maybe it was in dispute from independent contractor to employee, are you available then for disaster loans as a business or a solo practitioner? Unfortunately, at the county level, we get these concerns all the time, but these roll up to the state. It's something we're looking at. We're starting to hear a lot of questions about it. So I think it's just a fantastic question, something that I'm committed to looking into and making sure that at least through our Help Center line, we're able to point employees and businesses with questions like this in the right direction. So it's something we'll look at certainly in the coming days.
Thank you. And now we're going to take Spanish marks. Thank you.
Buenas tardes a todos. Gracias mucho a la supervisora Barger y gracias a todos los líderes del condado de Los Ángeles. Para actualizarlo sobre nuestras estadísticas de hoy, estamos tristes de reportar 25 muertes adicionales. Esto eleva el número total de muertes a 223 en el condado de Los Ángeles. Y nuestra tasa de mortalidad para COVID-19 es de 2.8%. Cada día informo estos números sabiendo que hay personas que están llorando a sus seres queridos que fallecieron por COVID-19. Todos ustedes están en mis pensamientos y oraciones todos los días. Hoy también estamos reportando 425 casos nuevos. Quiero agradecer al Departamento del Sheriff y el Departamento de Bomberos por compartir sus datos sobre los casos. El Departamento del Sheriff del Condado de Los Ángeles informa 27 casos positivos entre el personal. 447 han sido puestos en cuarentena y 188 han vuelto a trabajar. El Departamento de Bomberos del Condado de Los Ángeles está reportando 14 casos positivos entre el personal. Hay 26 personas que han sido puestos en cuarentena, 2 personas que están enfermos y aislados en sus hogares y 12 que han regresado al trabajo. Muchas gracias al Sheriff Villanueva y al jefe Osby por rastrear esta información. Tenemos el total de casos nuevos en el condado hoy es 7,955 y estamos reportando 425 casos nuevos. Hay 1,894 personas que han sido en algún momento hospitalizados, el 24% de todos los casos positivos. Puede ver el informe actualizado de los casos del Condado de Los Ángeles en el sitio web del Departamento de Salud Público. Esto es en publichealth.lacounty.gov. Actualmente estamos investigando 155 entornos institucionales con al menos de un caso confirmado de COVID-19. Estos incluyen hogares de ancianos, viviendas asistidas, refugios, centros de tratamiento, viviendas de apoyo y instalaciones correccionales. El total de casos confirmados en entornos institucionales es de 716, incluidos tanto el personal como los residentes. Los 343 de estos casos confirmados son con residentes y 373 son empleados. Nos entristece informar que 51 residentes han muerto por el COVID-19 en estos entornos. Esto incluye instalaciones de enfermería especializada y vivienda asistida. 23% de las personas que fallecieron en todo el condado eran residentes en estos entornos. Hasta el 8 de abril, más de 38,300 personas han sido evaluados en el condado de Los Ángeles y el 15% de ellos fueron positivos. Ciertos grupos de personas siguen siendo la prioridad para la prueba. Aquellos con síntomas y que un médico ha determinado que son apropiados para la prueba. Nuestra vida cotidiana ha cambiado radicalmente con la pandemia del COVID-19 y les agradezco a todos los que se quedan en la casa. Para aquellos de ustedes con niños pequeños, existen servicios preventivos esenciales que son importantes para la salud de su hijo. El cuidado de recién nacidos y niños sanos, incluidos las vacunas, es esencial, especialmente para los niños menores de 2 años. Todavía hay otras enfermedades como la tosferina que circulan y que pueden prevenirse mediante la inmunización. Los aliento a que se comunican con su médico o el consultorio de su hijo para saber cómo manejan los controles y las vacunas durante la pandemia de COVID-19. Es bien importante que los niños serán vacunados y que sean vacunados en el tiempo cuando necesitan las vacunas. Como mencioné, que esta semana tenemos que continuar todas las medidas que estamos haciendo para frenar la propagación del COVID-19 durante estas próximas semanas. Y gracias a todos los que han estado haciendo todo lo posible para quedarse en la casa y practicar el distanciamiento físico y el uso de máscaras fáciles si deben estar afuera de la casa. Estas acciones, por muy incómodos que sean, son muy poderosos para ayudar a prevenir de infecciones. Es una buena idea continuar planeando quedarse en la casa tanto como sea posible, lo que incluye recibir alimentos, medicamentos y otros suministros esenciales. Quiero de nuevo agradecerle a todos nuevamente por ser tan increíbles durante este tiempo tan difícil. Todos tenemos un parte importante en frenar la propagación de COVID-19. Muchas gracias por todo lo que están haciendo. Y ahora viene a hablar Azucena Favela, la directora asistente del Economic Development, Consumer and Business Affairs. Bienvenido.
Buenas tardes a todos. Yo soy Azucena Favela, subdirectora en el Departamento de Servicios al Consumidor y Negocios. Hoy voy a interpretar por el director del departamento, Nikita. Me gustaría comenzar por agradecer a todos ustedes que han respondido a la llamada de quedarse en casa. Ofrezco mi agradecimiento porque al permanecer más seguro en casa, está priorizando la salud y el bienestar de toda nuestra comunidad. Y expreso mi admiración porque sé, para muchos de ustedes, el permanecer más seguro en casa viene con un costo. Quizás mantenga su negocio cerrado por respeto a la orden de salud, o tal vez sea un trabajador cuyas horas han sido reducidas, o tal vez ha perdido su empleo. Si ese es usted, entonces sabe mejor que nadie que el coronavirus es una crisis no solamente de salud, pero también una crisis económica. El condado de Los Ángeles alberga a casi 500,000 de empresas pequeñas que emplean aproximadamente 1 millón de empleados. Es obligación del gobierno durante estos tiempos de apoyar a aquellos que con su sangre, sudor y labor son el motor que impulsa nuestra economía local. Estoy orgullosa de nuestra mesa de supervisores del condado y de nuestros líderes federales, estatales y locales por reunir fondos necesarios para apoyar a nuestros empresarios. La semana que viene, esta mesa de supervisores considerará una moción para establecer un fondo de ayuda para negocios. Pero además del apoyo financiero, el Departamento de Servicios al Consumidor y Negocios entiende que la información oportuna y precisa es crítica. Si es una empresa sin una relación de crédito existente con un banco, quizás no cuenta con servicios bancarios, si se encuentra fuera de la economía formal, si usted es uno del 71% de nuestras pequeñas empresas que tienen menos de 25 empleados y probablemente no tiene abogados, contadores o un departamento de recursos humanos, si no habla inglés. A menudo personas como ustedes son las últimas en enterarse, las últimas en saber y las últimas en la fila. La misión del departamento y el mío es de apoyar a usted y a empresarios como usted. El 26 de marzo, con el apoyo de la Mesa de Supervisores del Condado, establecimos el Centro de Asistencia de Emergencia para Negocios y Empleados. El Centro de Asistencia cuenta con personas reales, personas de mi departamento y de otros en el condado que están capacitados y listos para asesorarlo sobre recursos disponibles para su negocio. Y por cierto, juntos cuentan con hablar 9 idiomas, incluyendo el español, mandarín, armenio, coreano y otros. Y estamos ampliando esa capacidad cada semana. El personal del centro puede asesorarlo sobre el programa federal de protección de cheques establecido por la ley CARES, el programa federal de préstamos de desastre económico, así como programas de préstamos y becas locales que están disponibles por el condado, la ciudad de Los Ángeles y las organizaciones filantrópicas. Y una vez que comprenda cuáles son sus necesidades y sus opciones, el personal del centro también puede tomar el próximo paso de brindarle la asistencia técnica para guiarlo a través del proceso de una aplicación. Esta asistencia técnica se extiende a los trabajadores que también sufren por la pérdida de salarios. Nuestro equipo puede guiarlo a través del proceso de solicitud de desempleo, discapacidad y también conectarlo a trabajos con nuevas oportunidades y capacitación de la fuerza laboral. El centro de ayuda también es el lugar para averiguar si su negocio es esencial bajo la orden de salud pública o si no es esencial y debe cerrar. Hemos recibido muchas llamadas para poder ayudar a contestar esta pregunta. En los próximos días ampliaremos nuestro centro para poder incluir información para propietarios y inquilinos. En este momento, el departamento proporciona esta información directamente a través de nuestro sitio web y nuestro centro de llamadas. Estamos disponibles para contestar preguntas sobre las reglas aplicables a su situación particular. Si aún no sabe, el condado ha declarado una moratoria temporal en el desalojo de inquilinos, tanto residenciales como comerciales, y ha emitido una orden ejecutiva que congela temporalmente la renta en propiedades residenciales que son elegibles. Y esto es en las áreas no incorporadas del condado de Los Ángeles. La ciudad de Los Ángeles y otras en el condado han establecido sus propias medidas similares, que ahora son necesarias para proteger a aquellos que inesperadamente no pueden pagar sus rentas. Las leyes varían por ciudad y nuestro centro está disponible para ayudarle a entender cuáles son las leyes que le aplican a usted. Le voy a dar ahora un número de teléfono y la página web. El número de teléfono para el centro de ayuda es 833-238-4450. Otra vez, 833-238-4450. La página web es la covid19.lacounty.gov. Todos los recursos son disponibles a través de mi departamento y todos los departamentos del condado están ubicados en el sitio. Muchas gracias por su atención. Como no hay más preguntas, voy a invitar a Karen Ohanesian, que es la enfermera de salud pública con el Departamento de Salud. Gracias.
Բարի օր բոլորիդ։ Այժմ գուզեմ ներկայացնել մեր կարգավիճակի հիմա։ Այսօր ցավոք սրտով կհայտնենք, թե 25 նոր քեյսեր ունեցած ենք։ Մինչև այսօր 223 մահ կա Լոս Անջելեսի շրջանի մեջ եւ 2.6%-ն է։ Ամեն օր երբ կհայտնեմ մեր այս թիվերը, Գիտեմ թե շատ ծանր է այս խոսքերը եւ գիտեմ որ ծեր սիրելիներուն կմտածեք Գուզենք մեր խորին ցավակցությունները խնդրել ադոնք որ ծեր սիրելիները կամ բարեկամները մահացած են այս COVID-19-ով Մինչև այսօր 198 մահ կա Լոս Անջելեսի շրջան մեջ եւ մահացության մագարտակը 2.6%-ն է Գուզենք հայտնել մեր խորին ցավակցությունները ինչպես որ ասինք եւ այսօր գուզենք դեղացնել թե 425 նոր հիվանդներ ունենք իսկ վերջին 42 ժամերու ընթացքին ունեցած ենք 1045 հատ նոր հիվանդներ իսկ բոլոր Լոս Անջելեսի շրջանի մեջ 7955 հիվանդներ ունենք Long Beach-ի մեջ 287 Pasadenaի մեջ 94 եւ 20 հիվանդները դուն չունին 77% թրական քնություն ունեցած են Գուզենք շնորհակալություն խնդրել մեր ոստիկանության եւ հրսեջի դեպարտամենտներուն որբեսի իրենց թվյալները տվածեն ոստիկանական դեպարտամենտին մեջ 27 անց COVID ունի 447 անձեր քորենտինին մեջ են մեգուսացած են եւ 188 աշխատավորներ յետ կորձի դարձած են Հրշեջի դեպարտամենտը ուրեմն ունի 14 հիվանդներ 26 դունն են եւ 2-ը հիվանդ են եւ 12-ն ալ կորձի յետ վերադարձած են Նորին շնորհակալություն կուզենք խնդրել Sheriff Villanueva-ին եւ Chief Osby-ին, որովհետեւ աստիվերը մեզի տված են։ Հիվանդներու 24%-ը հիվանդացած գտնված են, որոնց թվը 18% են։ Ուրեմն բոլոր ընդամենը 1894 հիվանդներ ունենք եւ 24%-ը հիմա հիվանդանոցն են։ Վերջին տեղեկությունները գրնակ ունենալ մեր վեբսայթին publichealth.lacounty.gov Ներկայից ուրեմն 155 զանազան հաստատություններ ունենք, որոնք ունեցած են առնվազն 1 անց COVID-ով Այս դեղերն են ձերանոցներ, դուներ, որ գոքնեն ձերերուն, աբաստանրաններ, ինչպես շելթերներ, բուժման թեղերան գետրոններ եւ փանդեր։ Այս հաստատության մեջ գտնվին 716 кейսեր աշխատավորներու եւ ապրողներու մեջ։ Ուրեմն 343 հոգի այս հաստատությունները մեջ ուրեմն որ գաբրին ունին եւ 373 աշխատավորներ կան։ Ցավոք սրտի 51 հիվանդներ գմահանան այսօր մահացած են ներողություն COVID-19-ով պատճառով եւ գտնվին ձերանոցներու եւ այդ դեղերը որ ձերերը գաբրին եւ ուրիշներուն գոքնեն։ Մենք կուզենք մենք ուզենք ցեզի դեղագացնենք, որբեսի այդ փանդերու մեջ ուրեմն այսօր 47 հիվանդներ կան, 6 հատը փանդարգյալներ են եւ 41-ը աշխատավորներ։ Կալիֆոռնիայի փանդի գարավարական փանդի մեջ ուրեմն 11 հիվանդներ ունենք, 8 հատը փանդարգյալ են եւ 3 հատը աշխատավոր։ Մենք այս բոլոր դեղեցությունները գտնենք մեր վեբսայթին վրա բայց առաջ դեղեցություն կուտանք այդ անձերուն, որ գաբրին հոն, իրենց աշխատավորներուն եւ իրենց ընտանիքներուն։ Կուզեմ հիշեցնել, որ COVID-ի հիվանդները կբազմանան Լոս Անջելեսի շրջանի մեջ, մանավանդ այս հաստատություններուն մեջ։ Ներկայիս կաշխատենք այս հաստատություններուն հետ մեր օֆիսին հետը։ Եվ մենք լավակույնը գնենք, որբեսի ուրիշ հիվանդներ չլան։ Շատ բնակիչներ մեգուսացած են օրինավոր ձևով, որբեսի ուրիշներուն ավելի հիվանդություններ չունենան։ այսօր ապրիլ 8-ին 38300 հոգի քննություն ունեցած են եւ 15% թրական պատասխան ունին։ Ամեն շաբաթ կփարելավե մեր քննությունները, սակայն թեր թիվերը ավելի քիչ են։ Եվ երբեմն մինչև որ պատասխանը գարնենք ավելի ժամանակ կդեվեգոր։ Առաջի կարգին այս քննությունները կուզենք արտադրել անցի, որ ախտանիշներ ունի եւ կամ իրենց բժիշկը գտելարտրե որ այդ քննությունը ունենալու։ Ադոնք որ քննություն ունեցած են, գուզենք ասել թե եթե քննությունը ունեցած եք եւ մեկ ախտանիշ չունիք, հաջիկ փորձեցեք դունը մնալ քոնե 7 օր։ Եթե ախտանիշ առաջին չունիք, կրնակ հետո ստանալ։ Ադոր համար շատ կարևոր է որ քոնե 7 օր դունը մնաք, մինչև եւ եթե հետո ախտանիշներ եթե ունեցաք, պետք է մինչև քոնե 7 օր հավելյալ դունը մնաք եւ առնվազն 3 օրը այդ 7 օրվա մեջ պետք է առանց շերմություն եւ առանց ախտանիշներ ունենաք այդ վերջի 3 օրերու։ Եթե ախտանիշներ ունեցաք եւ սպասում եք ծեր պատասխաններուն, պետք է նորեն շատ ուշադիր լաք եւ փորձեք մեգուսանալ ուրիշները, եթե գգարձեք որ ուրիշ շփման մեջ եղած եք ուրիշ անձի։ Որևէ մեկը որ թրական քննություն ունիք եւ ախտանիշներ ունիք, պետք է բոլոր ծեր կորզագիցներուն եւ ծեր սիրելիներուն որ շփման մեջ եղած եք 48 ժամ առաջ ծեր ախտանիշները երբ կծծնի, հաջիկ պետք է բոլորին ասեք, որպեսզի իրենք ալ գիտնան եւ իրենք ալ քուարանտինի մեջ լալ։ Երկրորդ երեխաներուն համար։ Ադոնք որ փոքրեր ունին կամ երեխաներ, կարևոր են որ իրենց բզիկները լավ նային։ Պետք է իրենց բժիշկներուն թեր հետևին, իրեն ինչպես պատվաստումները, իրենց well baby visit-ները, որով ասիկա շատ կարևոր է, այդ պատվաստումները որ կստանան, ինչպես մեր գաբույթ հազը, եւ ուրեմն գուզեմ նորեն շնորհակալություն հայտնել բոլորիդ, որ այս մեր դեղեցությունները եւ օրենքները կհարգեք, որբեսի ամեն անգամ որ դուք կհարգեք, ուրիշ անձիմը կօգնեք։ Շատ շնորհակալություն։ This concludes our press conference today, and thank you.
Okay, ladies and gentlemen, that does conclude today's conference. I want to thank you for your participation. You may now disconnect.